responsible for making insulin. And insulin is a hormone that's produced that moves and regulates the sugar from the bloodstream into the cells to be used as energy. And people with type 2 diabetes require insulin administration to control their blood sugar, as opposed to patients who may have had type 2 diabetes who could be controlled with diet, lifestyle modifications, as well as some oral agents. In terms of prevalence of type 1 diabetes, based on data from 2018, about 6.1 million Americans do have type 1 diabetes, and of that 1.6 million, about 187,000 involve children and adolescents. Comparing the type 1 and type 2 diabetes, they are different. However, some of the signs and symptoms may present similar. But with type 1 diabetes, it's often diagnosed in childhood and adolescence. So you see it more commonly in young children. However, type 2 diabetes, it's often diagnosed in adulthood. Type 1 is insulin dependent, hence why those patients do need that insulin therapy. However, with type 2 diabetes, the insulin is resistant. In terms of risk factors for type 1 diabetes, most of the risk factors involve patients who have a family history of type 1 diabetes, and as well as the genetics, since it is an autoimmune response in terms of the beta cells being destroyed, and genetics is a very heavy risk factor and managed with insulin therapy for those particular patients. In terms of type 2 diabetes, family history is still a risk factor. However, diet, weight, and lifestyle choices also impact whether patients do have a type 2 diabetes diagnosis, hence why we oftentimes want patients to exercise, watch what they eat in terms of carbohydrates and sugar intake, as well as kind of exercising. And this type of diabetes is managed with diet, exercise, or medication, and insulin therapy as well. So you have multiple ways to manage these. And sometimes patients with type 2 diabetes can manage it with diet and lifestyle modifications that may not require medication at all. Next slide, please. I think that's it. So in terms of type 1 diabetes, like I mentioned before, risk factors include the family history and genetics, but diving more so into the signs and symptoms, you have the increased thirst, hunger, and urination that we often see, the polyuria, polydipsia, polyphagia. Patients also have complaints of being fatigued, blurred vision, delayed wound healing due to the uncontrolled blood glucose, and some patients experience weight loss with type 1 diabetes. Regarding the pathophysiology, type 1 diabetes is characterized by the destruction of the pancreatic islet beta cells, and this could be immune mediated, meaning the autoimmune destruction of the beta cells. However, it could also be idiopathic, meaning that patients do have that insufficient insulin, but there really isn't a presence of auto antibodies, and that's also a test that can be done to test for autoantibodies, which are oftentimes present in type 1 diabetes and not type 2 diabetes. And I wanted to give you a visual representation to show you that type 1 diabetes, you have insufficient insulin. So with the diminished supply of insulin, as seen above, you don't have insulin receptors, or you don't have the insulin to act on the insulin receptors that thereby regulate the fluctuation of glucose coming from the bloodstream into the cell. And you have that diminished glucose intake and that excessive glucose outside of the cell as pictured. Next slide. And this is also a visual representation that I wanted to show you that compares healthy type 1 diabetes as well as type 2 diabetes in terms of the insulin and the insulin receptor and glucose. So as you can see, with healthy patient, the insulin is there acting on the insulin receptor, thereby reading glucose from, give me just a second. Okay, I apologize about that. I'm presenting from the hospital. Sorry about the interruptions, but I also wanted to showcase with a healthy individual, you do have that consistent regulation of the glucose from outside of the cell into the cell. Type 1 diabetes, as you can see depicted, there is no insulin production, therefore nothing to act on the insulin receptor, and that glucose remains outside of the cell in the bloodstream. And type 2 diabetes, you have plenty of insulin, but due to the resistance and it not acting properly with the insulin receptors, you still have that glucose that is not able to be regulated from the bloodstream inside the cell. Okay. And I wanted to briefly talk about one of the complications of type 1 diabetes, which is a serious life-threatening complication known as diabetic ketoacidosis, also referred to as DKA. And it's a threatening complication of diabetes that's most common in type 1 diabetes because it occurs when your body doesn't have enough insulin to allow your blood sugar into the cells to be used as a source of energy. So your body starts to break down the fat in your body and it uses that as a source of fuel. And as a result of this process, you have a buildup of acids in the bloodstream called ketones. So particularly you see it, patients will have a high blood glucose of greater than 250, sometimes higher, and there's also a presence of ketones in the serum, in the urine as well. So those are the main factors. Signs and symptoms include thirst, urination, patients who may have this fast, deep breathing, may complain of a headache. Also, a common sign and symptom is this fruity smelling breath. So some patients will have or hear that they have a fruity smelling breath. Muscle stiffness, aches, nausea, pain, and vomiting are also common signs and symptoms. And in terms of treatment for DKA, treatment involves fluid and electrolytes, so providing patients with potassium as well as insulin therapy. And in terms of treating type 1 diabetes, it's important to monitor the blood glucose often in order to prevent hypoglycemia as well as hyperglycemia, and making sure that your patients are aware how to treat their lows using the rule of 15. And I mentioned earlier, treatment involves insulin therapy, and there are a number of agents such as the rapid acting, short acting, intermediate acting. You have concentrated insulin as well as long acting and pre-mixed insulin. And on the next slide, I have a visual representation in terms of the relative insulin effect for each type of insulin, as well as the time span in which it will last. So just kind of thinking about when you are initiating insulin in patients, being mindful of when to give it with respect to meals and making sure that patients are aware of the time for each insulin therapy, if there are different types of insulin and why it's timed that way. So that's an important factor that I think patients should know who are starting insulin therapy. And then lastly, I wanted to talk about some new and emerging technologies in type 1 diabetes. Some of you may be familiar with these agents. Some of it may be new, but some of the technologies that's used in this patient population includes a smart insulin pen that's depicted in the right top corner, and it's a pen that allows patients to connect via Bluetooth with their phone, so they're able to know and see how much insulin that they're administering, and the app on the phone keeps track of that information for them. You also have continuous glucose monitoring devices such as the Freestyle Libre and the Freestyle Libre 2. And this is an option where the machine can continuously check the blood glucose, or you can have it where you can intermittently scan the device and get those glucose readings. And you also have the automatic insulin delivery system as well as the insulin pumps, which are very similar. However, the automatic insulin delivery systems are kind of referred to as like a artificial pancreas, where it uses a combination of the CGM and the insulin pump to administer automatically the amount of insulin patients may need if they are dropping too high or too low. And insulin pumps as well, which is kind of like that continuous infusion of insulin based on settings that can be programmed into the pump. And patients are really enjoying these types of therapies because it reduces the number of times they may have to give themselves injections, or the number of times they may have to check their blood glucose, especially if they are giving multiple shots a day. And that completes my presentation. Does anyone have any questions?